In our headlines this evening, Customs Department commissions X-ray baggage machine and laser surgery now available at the Alexandra Hospital. The details are straight ahead. Good evening and welcome to the Nevis Newscast. Today is Monday, March 16th, 2015. I'm Donis Wilkinson Keynes. The Nevis Island Administration has invested in an X-ray baggage machine to prevent illegal contraband from entering the country. Premier of Nevis, the Honorable Vance Amory, notes the procurement of the machine is in keeping with the NIA's ongoing effort to protect the country's borders.
I think we are all aware of the threat which we face from criminal element willing to use any loopholes which they perceive may exist in our country. But the implementation or the introduction of this extra machine at customs will go a long way to reducing and I hope eliminating any effort by anyone to seek to use Nevis as a port of entry of illegal substances, whether it is weapons, ammunition, or illegal drugs.
The Customs and Excise Department on Friday commissioned the new machine at the Customs warehouse at Long Point. The Customs and Excise Department falls under the purview of the Ministry of Finance. Colin Doe is the acting permanent secretary in that ministry.
We have the first machine arriving, and over the past 3 days, there has been extensive training with the customs officers who would be using the machine on a day-to-day basis as part of their custom examination process. Now, this machine is a joint project between the Nevis Island Administration and the St. Christopher and Nevis Social Security Board. So we want to say thanks to the directors and management of the Social Security Board for assisting the NIA, partnering with the NIA in order to make this venture possible. Now, this machine, once being put in place, is going to enhance the custom checking process, because what would happen from here onwards is that every piece of cargo entering the warehouse would be examined via the X-ray machine. It would therefore give the customs officer a chance to expedite the way in which cargo is processed, so he can enhance the time taken to process those items.
Deputy Comptroller Sinric Carey describes the procurement of the X-ray machine as a timely initiative by the NIA.
This X-ray machine here is a very big step from the competent authorities in an effort to assist the Customs Department and to show their commitment in the fight against crime. It will not only assist us in detecting arms and ammunition before they get through our ports, but will act as a deterrent.
The customs officers are being trained by a representative of Security Equipment Services, which will continue to work with the NIA to upgrade all the equipment to further secure the island. A similar machine will soon be installed at the Vance W. Amory International Airport as part of the initiative to secure the country's borders. Certified urologist Dr. Dwayne Thwaites says that his team of urologists, which holds an annual prostate screening clinic on Nevis, has noticed that more and more men are having abnormal digital rectal exams with normal prostate-specific antigens, PSAs, which is an indication that they have to do both exams. Dr. Thwaites was giving a report on findings from the January 17th prostate clinic, where some 553 men between the ages of 40 and 70 were examined.
Abnormal PSAs was 1.4% of the total of the 553. Only about 1.4% were abnormal, which is lower than what we have seen over the last couple of years. On the rectal examination, which is most importantly, that number had increased and is now increased to about 5.6%, which demonstrates again, which I'm trying to get across to most people, who think that they can get away just doing the PSA and not the digital rectal exam. Here, what we're seeing now, decrease in the amount of abnormal PSAs, but an increase in the amount of digital rectal examinations which are abnormal, and that percentage is reflective of the 553 persons that we've seen. A combination of patients with both the elevated PSA and abnormal digital rectal exam. It was about 1.2% of the population had both abnormalities, both the elevated PSA and abnormal screening.
Of the 553, there was a 14.28% rate of abnormalities, which is down from 16%.
Later on, we'll give you the amount of cancer that we pick up, because now we're going through the process of biopsying the patients and that have abnormal examination and seeing which ones have prostate cancer. So we'll have a percentage of the total 553 who have prostate cancer.
Urologist Dr. Dwayne Thwaites. Meantime, laser surgery is now available at the Alexandra Hospital. The employment of 2 machines is facilitating a host of advantages associated with the technology for patients who require surgery. One machine, the Revelix, is the only laser specifically developed for soft tissue. Its benefits include a short hospital stay, less post-operative care, precise surgery, no deep tissue penetration, excellent hemostasis, treatment of patients under anticoagulant, ejaculation protective BPH surgery, and multidisciplinary. Anne McMillan is a surgical technician with US-based Carter Surgical, which supplies the machines.
It's a thulium laser, the newest technology for vaporizing prostate tissue and a number of other uses. It can be used in urology for the prostate, also in gynecology for endometriosis and fibroid tumors, also in ear, nose, and throat for stapedectomies. It's a very safe technology and easy for physicians to be trained in. It's a about 2300 wavelength. So the laser beam is looking for water. When it sees water in the tissue, it heats the water up, and that causes the tissue to vaporize. And that's how it works.
According to McMillan, the Revelix is a very safe technology, especially for prostate surgery.
You're working in the bladder, so that's an environment where the bladder is full of water at the time that you're working. So any laser beam will be, if it's not right on the tissue, it will be absorbed by the water in the bladder, so you can't inadvertently damage the bladder. There's not a lot of bleeding. The bleeding is mostly controlled during the surgery, so there's very little bleeding, and you have to have a catheter afterwards, a tube to take away the urine that collects in the bladder, but you only have to have it for a very short time. And because there's no bleeding, the old technologies, there was a lot of bleeding and patients had a long recovery period. The recovery period for this is just a few days.
The second piece of equipment facilitates precision and performance in urology and general surgery.
This machine, the Sphinx, is used for breaking up kidney stones and stones that are in the ureter, the path between the kidney and the bladder, and also bladder stones. So this is a little slightly different wavelength, but it still heats up the water that's in the stone. And it's a very efficient machine because it has a lot of settings, and you can adjust your pulse width, you can adjust the pulse energy, and also the frequency of the pulses, depending on if the stone is soft or very hard. And it will also work very well with strictures in the kidney or the ureter. So you can use it on soft tissue, so it doesn't have to be a stone.
The Sphinx's easy touch screen allows the surgeons to quickly select the parameters best suited for their patients and store them for future use. Coming up after the break, surprises in store for patrons of First Nevis Blues Festival. Stay tuned.
Empress Liberty, and I'm coming from St. Kitts. I want to big up NTV, Brown Hill Communication, and a Stitching Time.
Hi, I'm Purple, and you're in tune to NTV. Keep it locked.
Welcome back. Representatives of the United Nations Educational, Scientific and Cultural Organization UNESCO on Friday visited Nevis to determine how well the island has embraced the technical and vocational education and training TVET policy. The delegation met with Nevis's Premier and Minister of Education, the Honorable Vance Amory, and Permanent Secretary in the Premier's Ministry, Wakely Daniel. The team was chaperoned by Chairman of the St. Kitts and Nevis TVET Council, Clyde Christopher, and Coordinator of TVET at Nevis's Department of Education, Orette Smith.
In 2013, UNESCO was very much involved in the assistance to St. Kitts and the Nevis government and the TVET Council in formulating and developing a St. Kitts and Nevis TVET policy.
Ekaterina Sediakina is UNESCO's Associate Evaluation Specialist.
We are doing an evaluation, not exactly of how St. Kitts and Nevis is implementing the policy, but of the type of assistance that UNESCO provided your country with, whether you were satisfied with this assistance, and to see also what are some of the challenges in going forward and implementing this policy.
The other member of the UNESCO team was Bert Jan Biscoe of the Ockham Institute for Policy Support.
I'm the external consultant helping UNESCO doing this evaluation, having a good look on the TVET strategy worldwide of UNESCO and what we can learn from the strategy, and also provide input for a future strategy. We have a more in-depth assessment in 6 countries where UNESCO provided input in the policy development by doing policy reviews, but also taking further steps, providing input in policy development. And St. Kitts and Nevis is one of these countries, and we are very looking forward to learn also from this interaction and also improve UNESCO policies in the end, helping member states to improve their TVET policy.
In his comments, Premier Amory noted that at the beginning of this year, the Department of Education created an adult and continuing education unit which will focus to a large degree on the delivery of TVET.
I think it is critical to the future development of Nevis and of St. Kitts as well. And what we intend to do based on the policy which has been developed is to look at implementing, starting certainly in April of this year, a series of trainings in VOTEC work, vocational technical education training, because it is critical to our future development. We are saying that this year, 2015, we shall see a number of construction projects which will convert into hospitality projects when they are done. It means we have now to have a response very quickly in terms of a workforce to engage in the construction. And when the construction is completed, we need a workforce to deal with the delivery of the hospitality.
The Premier says in addition to this, the NIA intends to implement training exercises to help individuals who have entrepreneurial skills to start their own businesses.
Whether it is in dressmaking, in cake making, in craft making, or becoming specialized skills tradesmen in plumbing, electrical work, and so on. And this really is in response to what we see as a future economic development of our country. And I want to thank the UNESCO team for coming to discuss with us so that we can refine our own thinking, and to thank UNESCO as well for engaging and assisting us in the development of the policy, and to thank all of the staff who are engaged in the development of the program and the development of those programs, because it's going to be an essential part of our future development and our sustainable economy.
According to Premier Emery, his ministry will be following up on some of the issues which were discussed, especially with regard to establishing priorities and getting the island's facilities up and running in order to respond to the demands of the people of St. Kitts and Nevis. Preparations for the first Nevis Blues Festival, scheduled for Thursday, April 16th to Saturday, April 18th at Wally Bay, are well underway, with the Odyssey Band confirmed as one of the local acts for the festival, while negotiations are ongoing with other local bands. That is according to financial control at the Wally Beach Resort and one of the organizers of the Nevis Blues Festival, Shari Greaves. She recently spoke with Hazel Francis, Communications Officer in the Ministry of Tourism.
The area has been cleared. We are working very, very closely with the Nevis Island Administration and particularly with the Ministry of Public Works. They have come on board to assist us greatly. So we are clearing the site. The stuff are going to be picked up very soon. We are also working to get all of the local bands confirmed. We, as we've been mentioning, as we've been saying, we have already the 3 international acts confirmed. Denise Gordon, who is no stranger to Nevis, Zach Harmon out of Texas, and Ian Seagal, the blues man of the UK.
Tickets are already being sold, and Greaves is urging persons to get theirs early. According to Greaves, the Saturday night will be full of surprises, and she's advising persons not to miss out.
We've been selling tickets like crazy. For some strange reason, everybody wants a VIP ticket. Everybody wants VIP access, and so the VIP tickets have been selling. We have just a few that we were selling, and we just want to keep it as a nice, intimate setting. On the Saturday night, we are going to have something extremely special that is going to kind of close off the blues segment of the show. So come out. I'm not going to say what it's going to be, so you have to come and experience it for yourself.
Federal Minister of Tourism Lindsey Grant, who was visiting the resort at the time, expressed his support of the festival.
I'm very happy and delighted to know that we're going to have a blues festival. I think it's April 16th to the 18th. It adds to our tourism product, and I can only imagine that we are going to have persons who would come during that period who normally would not come, and so it's going to add to the visitor arrivals in Nevis and in St. Kitts.
Tickets are available on the websites www.nevisbluesfestival.com. Persons can also email reservation at nevisbluesfestival.com or call 869-667-5427. That's it for this evening's edition of the Nevis Newscast. Thank you for viewing. Good night.